Modern medicine relies on groundbreaking technologies to diagnose many diseases. One widespread method is magnetic resonance tomography. It provides doctors with high-resolution images that reveal the structure of internal organs, like the brain, in great detail. But how to deal with the wealth of data?
Radiologists have very little time to analyze images nowadays, maybe just 10 minutes per patient to look at 200 or even 400 images. They have to rely on their experience. Our software, by contrast, analyzes each individual pixel and captures specific structures in the brain.
Machine learning makes it possible. Computers are fed huge amounts of data and trained to identify the patterns that could indicate certain diseases. For example, multiple sclerosis and other brain disorders. In fact, the more data, the better they get at the task. AI diagnostic systems, such as the one made by one Berlin startup, sometimes outperform doctors.
Eventually, we'll be able to automate every part of the process. There will be more and more software to address very specific questions. In the end, a radiologist will only have to check over certain information. The software will do everything else on its own.
Machine learning is also playing a role in the fight against COVID-19. For example, in developing new tests for the coronavirus. An app is in the works that uses coughing, sneezing, and other sounds from the voice as biomarkers to detect the disease. It may not replace the PCR test, the gold standard for detecting infection, but its developers say its accuracy is around 90%. They're still collecting audio samples to train the software.
The lungs' activity during coughing and laughing, for example, reveals how much pressure can be exerted with the lungs. Our signal processing algorithms measure these things. People are submitting audio samples that we are using to train our AI. We also ask them if they've tested positive or negative and if they have any symptoms.
When artificial ventilation is required for patients with severe respiratory disease, the risks are high. The ventilation can itself damage the lungs, driving up the death rate. A startup in Munich has developed AI software meant to increase the survival rate. It creates a digital model of a patient's lungs, a digital twin, and simulates the airflow in the lungs. It can then fine-tune the pressure the ventilator should apply to each patient.
Until now, doctors weren't able to see inside the lungs. They only saw from the outside how much pressure the ventilator was applying to the trachea. With our technology, doctors can really look inside and see what happens with the air in the lungs, where it goes, and where it overstretches the lung tissue. What's more, since it's a digital tool, it can be tried out on each patient's digital twin without causing any harm before it's applied to the real patient.
The software has yet to be licensed for medical use. The company aims to bring it to market by 2023, though hopefully by then, COVID-19 will be history.